kind of a bittersweet moment. And you know, it's a wonderful time. Each year we get to honor two people who are dear to us at the Mental Health Association, which was Mike and Harry Hall. Mike Addesso and Harry Hall in the awards in their memory. Of course, every year we usually have both their parents here. We have Joe, who was Mike's father, but we don't have Pat Addesso. I think everybody knows that Pat Addesso died within this year, and she was a very dedicated MHA supporter. So it's kind of bittersweet as we give out this award. I did want to, and I don't know if I could get through it, I do want to read what I wrote in my that was read at her memorial.
You let Charlie read it again.
I feel like Charlie read it again. Because I was not able to go to her memorial. But,
it was in phonetics. I can't read it, it's not phonetics.
But I feel like it's important to take a moment to remember Pat. Okay? And this is what I had Charlie read for me at her memorial. As the CEO of the Mental Health Association of Ulster County Incorporated, I have had the privilege to work with Pat for many years. Pat served on the MHA Board of Directors for many terms. She was part of the soul of the agency and will remain part of its fabric forever. Her love and devotion to her family served as a role model and inspiration to everyone who is a family member coping with a serious mental health issue. Her tenacious support for Mike helped him to feel love even in his darkest time. I believe that love helped Mike to find health, joy, and peace despite his many obstacles. She became a strong advocate for a better service system of mental health care in Ulster County, and we are grateful to her for her many successes in this area. MHA will never forget her and will remain dedicated to assisting every person to find mental health. I want to say also that knowing Pat over these many years has been a personal joy for me. She gave me warmth, strength, humor, and power to live my life better. I will miss her very much. Just having her presence in a room made it a better place for me. I know that she is at peace and is happy and fine now. I know too that she is taking care of her family, but just from a different place. I just want to thank the Addesso family for still being with us and being here to honor Mike, but also now to honor your mom too. So, thank you. So, in doing that, we're going to present the Mike Addesso Memorial Award. And along with these two memorial awards, we also have certificates of merit and certificates of appreciation from our local representatives who have said, we have something from Kevin Cahill, we have something from Senator Bonasek, and we also have Tony Sinaga, who has something for each of the award recipients from Senator Larkin. So I want you to know that you're going to be receiving that also. But I want to bring up the representatives from the Institute of Family Health who are going to be receiving the Mike Addesso Award for 2010. We decided to honor the Institute of Family Health for a number of reasons, but one specific reason. For everybody who doesn't know, the Institute for Family Health used to be family practice. And for people who don't know, they really are the people committed to making sure that everybody has access to health care. It doesn't matter whether or not you have insurance or not, or if you have Medicaid or not. And if it wasn't for the Institute, with the medical needs of many of the people that we provide service to MHA, but for many people living in our community, they wouldn't really have good, affordable, accessible health care. Okay? But the reason we're giving them an award today was they decided that's not enough for them to be doing that. Right? They also feel, and they know, that their commitment is not just to people's physical health, but they look at health in the holistic manner. And they came to me and they said, and I think it was Verna and Monisha Manning, who came to me and said, listen, Ellen, I heard that you've been trained in models that can help people to recognize people with thoughts of suicide, and then you have another model where you can teach some of my staff to also be able to intervene with someone who's at risk of suicide and actually can do an intervention and can do suicide first aid. we want you to train all of our staff in either one or the other. Okay? How many staff up here?
Oh, up here, 350.
Right. Okay? And then they also have their other offices in the city. And so because the Office of Mental Health has trained a number of us throughout the state, we've been working with the Institute to make sure that they got what they needed. And that was to train each one of their staff. So everyone at the Institute can either identify a person with thoughts of suicide, or some of them can also do an intervention when that person is at risk for suicide. Think about that. You know, we know that when people have thoughts of suicide, they don't come to a mental health worker, right? But if you read most of the studies around people who have had suicide attempts or who have died by suicide, many of them have gone to their primary care doctor.
Within the month.
Within the month.
And 20% within the day.
Within the day. This institute decides, you know what, we're going to take that responsibility serious. We're here to make our communities suicide safer. So that's why I'm honored to give to Verna in your institute this award in Mike's honor. Sorry, you want? The award said, the 2010 Mike Addesso Memorial Award is presented to the Institute for Family Health in recognition of your efforts in creating suicide-safer communities by training over 200 staff in the Hudson Valley in suicide prevention. By the Mental Health Association in Ulster County Incorporated, May 25th, 2010. Congratulations. The other thing was good because I did most of the trainings. Was that I got to meet the staff here, and I can tell you they're very impressive bunch of people.
Oh, well, thank you. And thank you very, very much. This is incredible. We're really, we're very, very grateful. And it was very important to us to train everyone for a couple of reasons, not only because, you know, of some of the figures that we just talked about and people coming in and talking to their doctors, but also because we did have suicide affect our staff over the past year. So people were very committed to do this. And so I really appreciate it, and we're going to continue. So thank you so much. Thank you very, very much.